Did you know that Wikisana is the largest search engine for holistic medicine?
Welcome, dear viewers, to our format today, Natural Medicine. Joint problems, knee pain, arthrosis, in the final stages, a new knee joint is often recommended. But what if there are other solutions that really still work and also bring freedom from pain? We're going to hear from Dr. Harald Burgard and a patient who will tell his story. I'm looking forward to it. Stay tuned. Hello, dear Harald. Nice to have you back.
Hello, good morning.
Yes, you always have patients who you bring here or bring in via Zoom. But it's also really about joint problems. They are having a massive increase. We have a lot of artificial hip operations, where many health insurances are now asking whether everything is always so necessary, but the pain is the great suffering from the patients. And you have found a very special method for you where you finally have your success with the patients.
Yes, exactly. We always see more patients with arthrosis. People are getting older, thank God, but it has consequences. And in school medicine, of course, you assume that you treat conservatively first. You try to get the joints pain-free via injections, hyaluronic acid, movements, physiotherapy, etc., or to get them less painful. If that doesn't work, joint replacement is recommended as a normal procedure. Joint replacement can be done, but of course such an artificial joint won't last forever. And it's connected with operations, with risks. Not every patient wants and can be operated on. And at some point, I got to know the gold implantation as a method, in a simple way, with needle technology, in local anesthesia, and usually with a single treatment, to give people relief or even pain-free. And that's what it's about. And that's a method that many people don't know. Many in the veterinary medicine do. There it's been around since 1983. And today we have a patient with us, Hans Veit, who had such a procedure and would like to tell how it went for him.
Yes, great. Hello, Mr. Veit. Thank you for your time.
Hello.
And of course, we are very interested in your story about your knees.
Yes, I had knee problems. And in the spring of 2022, it was so massive. Then I went to the doctor, and he transferred me. Then I would have to do an MRI. I did that in St. Ebert, and the doctor told me that my knee joint was totally broken. So there would be nothing to do. There would be no more joint lubrication in it. Bone to bone, there would be no possibility to repair anything. I would absolutely have to have an appointment for a new knee joint. And yes, I had massive pain. And through my practitioner, she then told me the address of Dr. Burgard. And then I called and made an appointment to find out more about it. Because what you don't know is actually not easy to do. And I listened to the conversation with Dr. Burgard. He informed me very well. He also explained it very well to me. And I also got it. And then I went for an operation. That was 2 months later. And that went smoothly, I have to say. That was problem-free. Within 2.5 hours, I could leave the practice again. Get off the operating table and go out. That was wonderful. And I am pain-free to this day and have no problems. I can walk, I can ride a bike, and can do everything. Everything works wonderfully, and I'm pain-free to this day. Thank God. And I hope that I am for a long time.
Wow. Basically, if you think about it, what does such an artificial knee surgery have in the end? What consequences? Or what kind of intervention is it at all? Because these are often the stories that we hear from you now and from other patients. Exactly, that was avoided.
Yes. I also had a good friend of ours from Bruchmühlbach. who had been operated on his knee and had very large, massive pain at night and could hardly sleep at night. And I also told her about, I recommended it to her. And she also had it done at Dr. Burgard. And she said, I should have done it earlier. So she is also pain-free. She is also very well. She can walk again, can run with her running team, which she could not do before. And as I said, she sleeps through at night and says she is also top satisfied. This is Miss Sonja Jung in Bruchmühlbach.
Super.
Yes, fantastic. And how long did it take until you noticed that there was improvement?
I have to say, after 8 days, it got better and better. Actually, after 14 days, 3 weeks, I have to say I was actually also pain-free. I didn't notice anything anymore. I was surprised that it worked so well, I have to say. I would do it again at any time.
You also had a very severe damage. It is called bald cartilage. You just said yourself, cartilage on cartilage. You usually assume that it can't work at all and that the knee can no longer be pain-free. But we have actually seen, for years, for decades, that it does work and that many people don't even think about it. A new knee joint can be done. Yes, of course, it is also necessary in some cases, no question. But it's a long treatment with rehabilitation, with, of course, the potential risks that infections come in, that it can't work either. About 10% of joint replacement operations have to be repeated every year, and it doesn't last forever, while a gold implantation usually lasts for decades or a lifetime. Did you have any complaints after the operation?
No, no complaints, no.
Yes, impressive.
And you could basically leave the practice as normal as you came?
That's exactly how it is, yes.
Perfect. Is there any data or facts, or is it lifelong?
Yes, as I said, I can only look back on my few years how I treat, but I know that from Mr. Kjagergaard and from other colleagues who have been treating for decades and who say, of course, it doesn't last forever with 100% of all patients. But many have rest for decades, and when patients come now, who are somewhere in their 70s, they no longer have 40 years to do with it, but usually it lasts until the end of their lives.
Super, very nice. So you're definitely enthusiastic.
That's how it is, yes.
Can you show us a photo of your knee?
Yes, I still have the X-ray and the entry point. We'll take a look at that in a moment.
Exactly.
Yes, so you can see here, Corinna, you can see the X-ray in the picture, and then you can see that the joint gap on the right side is narrower. And the knee is a bit shifted to the side, and this narrowing happens when the cartilage goes away. And here where you say, in the X-ray, in the MRT, okay, the patient needs a replacement. That just hurts because this cartilage gives inflammation to the capsule, and that's exactly what we take out. And the patient had an atrocious degree 3 with bald cartilage. There were already small cysts, there was already an inflammation in the bone, and there are also some things at the edges. You can't see that exactly here. And then I did the following. Up there, you see the knee. There you can see the green spots. Obviously, as a lot more, that's just one take. And wherever the gold is placed around the knee, it lasts a lifetime and takes the inflammation and swelling and thus also the pain in the long run.
So it doesn't really look painful, the whole intervention.
No, not painful at all.
Great.
We did this in local anesthesia at the moment when I gave him the syringe for the anesthesia. That stings a little bit, but after that, you are anesthetized. And you talk to each other. You also talk to me at the operation and with the helpers. You notice what we are doing, and the intervention takes about an hour, and then the patient can go home when he has the patch on, and they could also take off the patch the next day, and then you can take a shower again, bathe, whatever you want. That's already closed.
This is actually such a dream situation that the patient is pain-free again and can move the joint, can ride a bike, and thus, of course, possibly a regeneration of the cartilage can take place again.
Yes, basically you can participate in normal life again. You notice that too, Mr. Veit. In what way the cartilage regenerates is rather questionable. It will maybe regenerate a bit, but you can walk on such a cartilage defect if there isn't pain the entire time. That lead to the joint closing. So to speak, an immobility arises, and this also triggers overload on the spine and so on. So you can now walk normally again, do sports or whatever.
Yes, exactly. As I said, I can do everything. I can do sports, I have no problems. And the whole thing, as I said, I went in just before 11 o'clock without crutches, and I'm out again at 1 o'clock. It was really smooth and explained very well how the anesthesia takes place. I waited another quarter of an hour before the gold implants had to come in, and then I just lay there for half an hour, and then I'm out again without crutches. So it was great, I have to say. In a short time, everything was over. The operation was over. It was smooth.
We usually don't have complications because we don't do it like that in a major operation, under highly sterile conditions. And I've never seen any effect or anything like that, because you only do it with needlework. You don't cut anything. So the risk of a major wound is not there at all. And the people come, they go, they can take a shower the next day. So they can basically follow their life. They didn't have to go to rehab or do anything.
No, nothing at all. No medication. I didn't take anything and was pain-free after a short time.
And then, of course, it's back to this preventive area or therapeutic, the follow-up diseases that can arise due to the lack of movement. Then there's high blood pressure, diabetes, maybe a little weight gain, and those are also things.
Yes, of course. If you can move well and want to move, if you can and want to, then you can lead a normal life again. And thus, of course, also avoid follow-up diseases, as you just mentioned, and also follow-up complaints on the skeleton. Because if I have pain on my knee and can't move properly, then I leave it to the other side or the back. Then I get back pain, migraine, disc herniation, whatever. You can, of course, if the organs, the joints work again, also avoid that.
How did you come up with the method?
As I said, I was from the therapeutic practitioner, and then I talked about that I have knee problems and pain. And he then advised me to get a new knee joint. And then he said to me, I know Dr. Burgard, I heard about him, and he has a good reputation. I can only recommend to get in touch with him and at least listen to it. That's what I did.
Perfect. Nice. Then thank you very much. I hope so. And thank you for your time. Hopefully many more years pain-free.
Thank you very much, and all the best to you.
Thank you. Have a nice day.
Great. Yes, Harald. Great. Nice to hear a patient example again, especially when it went so uncomplicated and quickly into pain freedom. And I wish you all the best. Many so satisfied patients.
That's the usual, thank God.
Yes. And if anyone would like to read in a little more about Dr. Burgard, yes, on my website, www.drburgard.de, you can read everything, but also feel free to contact us, call, send an email, and then the patient will get all the information he needs. Great. Thank you very much, Harald. See you soon.
See you soon.
Dear viewers, if you have knee problems and have found a solution for yourself, that's great, since we always have wonderful guests that show us new possibilities, and I am always happy when you watch. Thank you for that. See you soon. Bye.